Hello, welcome and good afternoon. Today is July 24th. We are welcoming you to the AARP's Public-Private Strategies and NAWBO webinar, Are Your Employees Medicare Ready? A Small Business Guide. Thank you all so much for joining. My name is Ashley Powdar. We are going to get started in just a moment. Before we do, just a few housekeeping items. This call and the rest of the webinars will all be recorded. If you're tuning in from LinkedIn Live, welcome, glad to see you. You can also catch it on LinkedIn Live, and we will share the recording after the call. So we really are grateful for you being with us today. If you have any questions, we ask you please use the Q&A function. And if you would like to introduce yourself in the chat, share any resources, please use the chat function. It just helps us track your questions more effectively. So thank you guys so much for joining us today. And before I introduce our keynote speaker, I just wanted to say a sincere thank you to all of our partners who are helping make this series possible and delivering some really trusted, fresh content to you, our small business audience, and our small business owners. As I mentioned, we are thrilled to be joined today by the National Association of Women Business Owners Chair, Thresette Briggs. Thresette is an award-winning speaker, certified leadership consultant, and Chief Performance Officer of Performance 3, a national leadership development firm she founded to help organizations build inclusive cultures that drive sustainable performance. With more than 30 years of global leadership experience, Thresette has partnered with clients across industries, including Fortune 500 companies, nonprofits, government agencies to align people, strategy, and culture for transformational results. She is a certified virtual presenter, professional speaker, and passionate advocate for women in business. As a chair-elect of the National Association of Women Business Owners, Thresette brings her commitment to advancing inclusive leadership and empowering entrepreneurs at every stage she graces. With that said, I would like to welcome you, Thresette, and thank you so much for joining us.
Oh, you're very welcome, Ashley. Thank you, and good afternoon, everyone. I am Thresette Briggs, Chair-elect of the National Association of Women Business Owners, also known as NAWBO, and the Chief Performance Officer of Performance 3, where I spent my career helping organizations align people, strategy, and culture for inclusive, sustainable growth, as Ashley shared. It's a privilege to be with you and our partners today for such an important discussion. At NAWBO, we represent thousands of women entrepreneurs across the country who, like many of you, are leading small businesses through rapid change and making countless decisions about how to best support their teams. One of those decisions, how to navigate Medicare with and for your employees, isn't always straightforward. When a value team member turns 65, questions naturally arise. What are our responsibilities as employers? How does Medicare fit in with existing group plans? And how can we offer guidance with compassion while staying compliant? That's why today's session matters. Together with AARP and public-private strategies, we're bringing you not just information, but clarity, delivered by trusted experts. It's about helping business owners like you feel prepared, empowered, and ready to lead through this moment with confidence. As someone deeply committed to inclusive leadership and workforce equity, I know that the way we support our employees and definitely our members in NAWBO at every age and stage shapes the culture and longevity of our businesses. NAWBO is proud to support this work and proud to stand with organizations that recognize the value of a multi-generational workforce. Thank you for joining us. If you would like to know more about NAWBO, I'm certainly here and you can reach out. And with that, I'm pleased to turn it over to Xavier to get us started.
Well, thank you for that great introduction to today's session. And, Medicare is something that impacts us all, right? This is something, whether it's going to be for ourselves or for a loved one that we care about. This is something that we're eventually going to have to think about whether we enter Medicare because we're retiring or we get on it through a disability. Medicare is a great equalizer that a lot of people don't understand. So I am excited for this section for today, where we can dig a little deeper into Medicare. So our agenda for today, we're going to go over some of the Medicare basics, educating you on your employees on what they may need and resources and tools that are available to them. So some of the common questions we may get is, what is Medicare? How does it differ from Medicaid? What is covered? What's not covered? Should a person enroll into Medicare? Do they have to? And if they don't, then what will happen if they don't enroll? And how will Medicare work with existing healthcare coverage? So your role as a business owner is to provide Medicare eligible employees with educational materials about Medicare, connect employees with unbiased sources of information, and help Medicare eligible employees to avoid any penalties that may be associated with late enrollments. So what is Medicare? Medicare is a federal health insurance program for people age 65 and up, or if you're under the age of 65 and you're collecting SSDI that 25th month, you'll be automatically enrolled in Medicare. And if you're age 65 and you're already collecting your Social Security, then you'll also be automatically enrolled into Medicare. But if you're 65 and you're still working, or if you have end-stage renal disease or ALS and you qualify for Medicare that way, you have to actively enroll into Medicare. With end-stage renal disease, you have to be receiving dialysis for 3 months. And for ALS, as soon as you're diagnosed, you can go ahead and sign up for Medicare. So your employee responsibility is going to be very similar to what they are already used to, right? You're going to have your monthly premiums, your deductibles, your co-insurance, and your co-payments. So what isn't covered through Medicare? Medicare does not cover hearing, dental, and vision. For the most part, there are some different things with like diabetes, or if you sign up for a Medicare Advantage plan, some of those plans may have hearing, dental, and vision. But when we talk about just original Medicare, that is not covered. And also long-term care is not covered. So if you need a nurse, you have to go into a nursing home or different things like that. Medicare is not covered. You will have to have either be on Medicaid or have some long-term insurance, care insurance, in order to qualify for that. So the different parts of Medicare. Part A and Part B together is what's known as original Medicare. You may also hear referred to traditional Medicare, but largely at this point is everyone calls it just original Medicare. And this is going to be your hospital insurance, your inpatient hospital care, some hospice and home health care, and some skilled nursing facilities care. It is very important that you do not get confused skilled nursing facility and nursing home as the same thing. Skilled nursing facility, you may also hear that referred to as a SNF, SNF. That is like your rehab. So someone had a stroke and they need to go to a rehab to learn how to walk, to have some speech therapy and different things like that. That is where they would go to. They would go to a skilled nursing facility. So that is someone who there for temporarily and not maybe until the end of life, like a nursing home would be. So most people pay no premium for Part A. You have to work about 10 years and you qualify. I am 31. I have qualified for premium-free Part A for a few years now. So it's something that you get fairly early on in your career. You can also draw off from a parent or a spouse work credit. So if you say, if you have a child who is qualifies for Medicare through disability, and so they never really entered the workforce, and they would be able to draw from a parent in that situation. Deductible for 2025 is $1,676 for days 1 through 60. And deductible can apply again for additional hospitalization after 60 days. So if you go into the hospital on the new year, you had a crazy New Year's Eve, and you go into the hospital, you have to go into the hospital, and the next day you go into the hospital on New Year's Day. And then you have to go back to the hospital for in May. You would have two different deductible periods. Part B is going to be your medical insurance. And how I like to go, remember that A is per hospital and B for medical. If you put hospital and medical in alphabetical order, they coincide to their parts. So this is going to be your doctor visit. We have to go see your primary. Outpatient hospital services, some durable medical equipment, which includes maybe a hospital bed, a wheelchair, and Medicare-approved preventative services. Medicare offers a large list of Medicare-approved preventative services, from cancer screenings, STI screening, smoking cessation classes, obesity counseling, the list goes on. So for Part B, the standard premium will be $185 per month for those enrolling for this year. And premium will go up for those who have higher incomes. So if you are an individual who makes 106 or a couple who makes 212,000, you will have to pay a higher Part B premium. And it's also really important to note that it is a sliding scale. So an individual who makes 106,000 versus an individual who makes 500,000, they will not have to pay the same higher Part B premium. An annual deductible is $257 per year, and coinsurance is 20% for most services. So if you were to go to the after your deductible is met, you go to the doctor, and you would have to be responsible for 20% of your primary doctor visit. Part C is Medicare Advantage plans. This is you'll hear it as either Part C or Medicare Advantage plans, same exact thing. This is when you see those Medicare commercials, you see JJ from Good Times on it. He's talking about these plans right here. And it's an alternative to original Medicare. And in this day and age, we love a good bundle deal, right? We bundle our cell phones and our internet into one comprehensive plan. And that is exactly what the Medicare Advantage plans do. They bundle your Part A, Part B, and most of the time your Part D into one comprehensive plan. And unlike original Medicare, which is administered through the federal government, Part C, and then the same thing for Part D later on, these are plans offered through private insurance companies, but they do have oversight still from the federal government. And these are going to feel very familiar to your employees, right? Medicare Advantage plans are going to have your HMOs, your PPOs, and they'll feel very familiar to what their employer-sponsored healthcare coverage will be. The thing about Medicare Advantage plans, you must live in the plan service area. Unlike with the original Medicare, which service area covers is nationwide, and Medicare Advantage plan are very regionally based. You have to use providers that are in the plan network. Unlike with the original Medicare, you can go to any provider that accepts Medicare. You may have to pay an additional premium. So remember, we have the Part B premium that we have to pay for, but then in addition, you may have to pay more of a premium to do this. And you have to follow the plan's company rules when it comes to seeing getting a referral to see a specialist. The great thing about this is about Medicare Advantage plans, though, is that they do have an out-of-pocket max. So unlike with the original Medicare, where you're responsible for that 20%, here you're going to have a cap on that 20 on what you can spend through a calendar year. Part D, which is prescription drug coverage. Remember, D is for drug. Helps cover the cost of prescription drugs that you can pick up at the pharmacy. These are also administered by private insurance companies. You have to pay a monthly premium to be enrolled into a Part D plan, and an annual deductible up to $590. And people with higher incomes, once again, have to pay a higher Part D premium. So Medicare choices. This chart kind of just goes over what we have already talked about. You can either get your Medicare through original Medicare and pick up a Part D plan. Part D is technically optional, but if you do not sign up when you're first eligible, then you will have to pay a penalty. And so you can do original Medicare and have A and B and pick up a Part D plan. And you can also pick up a Medigap plan. Or you can go the Medicare Advantage route and that combines A, B, and most of the time D into one plan. So with the original Medicare, and this is just kind of be another repeat and summary, it's a fee for service. It includes Part A and B. You can go to any provider that accepts Medicare, and most providers are going to accept Medicare. And then choose to join a prescription drug plan if you would like. Medigap, as I was mentioning earlier, this is something that you can pick up with with original Medicare. And just like the name suggests, Medigap or a supplemental insurance policy, it helps supplements or fill in the gaps that lack with original Medicare. So once again, these are sold by private insurance companies, and they help cover deductible, co-insurance, and co-payments. And you cannot have a Medicare Advantage plan and a Medigap plan. And they have up to 8 standardized plans, so you can choose and compare it easily. And the plans are also letters. So you're going to have a Plan A, a Plan B, a Plan C, and a Plan D, all the way to N. And do not get Plan A and Part A confused. Those are two very different things. So you have to buy a policy within 6 months enrolling to Part B. You have to pay a monthly premium, and it does not cover prescription drugs or any additional services like hearing, dental, and vision. So you may have heard of the Inflation Reduction Act, and this act has had a lot of really great ramifications for Medicare and improvements. So as you're probably aware, insulin is now available $35 per month per covered prescription. So this is not saying that every plan is going to cover every single position or prescription, but every plan is going to have an insulin that's covered at $35 per month. And this is why it's really important to have the conversation with your doctor and say, you know, my plan cover this insulin that I can have, or do I need to switch it to a different plan during open enrollment? We have access to recommended adult vaccines without cost sharing. Last year, there was an expansion of low-income subsidy program, or LIS, or extra help, that you may hear referred to, and it expands part on this assistance program to 150% of the federal poverty level, which is what will help a lot more people. And we also have a yearly cap of $2,000, and that's just started this year. So there used to be a much higher level threshold that a person has to meet, but this year is only $2,000. And not only is it $2,000, that $2,000 can be spread out throughout the calendar year. So say if you have a high medication that would typically cost you $500 per month. Instead of you spending all of your $2,000 in the first 4 months of the year, you can now spread that out through the entire calendar year. So when do employees need to enroll into Medicare? They have their initial enrollment, a special enrollment, and then they have open enrollment. So initial enrollment is for a person once they turn 65, and they have a 7-month period in order to do so. They have 3 months before their birth month, and 3 months after. The one caveat to this is if you're born on the 1st, then your birth month gets moved up a month. So the example I always use, my Uncle Charlie, his birthday was I'm June 2nd. His birthday was June 1st. And so instead of June being his birth month, May would actually become his birth month. And then you also have, or you can sign up late, which is not recommended, and you may have to pay a higher premium for Part B and D. Special enrollment is for employees who do not enroll in Medicare when they are first eligible. So they can enroll during a special enrollment period, and this period is available to age over 65 and they're currently working are covered by a spouse, or if they lose their coverage at the end of their employment. So open enrollment is the same exact time every single year. It is October 15th through December 7th. Doesn't matter if it falls on a weekend, it's the same time. And this is when people who are already enrolled into Medicare can make change. This is not the time to sign up for Medicare. If you think, oh, open enrollment, I missed my initial enrollment period. This is the time for me to sign up. No, this is for people who are already enrolled. And during this time, if you're on a Medicare Advantage plan, you can switch to a different Medicare Advantage plan, or you can go back to our original Medicare and pick up a Part D plan. Or you can do the opposite. If you're already in the Medicare Part D plan, you can go to a different Part D plan or pick up or switch to a Medicare Advantage plan. This is not the time to shop around for a Medigap plan. Medicaps are when you are first eligible for Medicare. You can try to sign up during this time. Just if you say have a Medicare Advantage plan, you try and switch to original Medicare. But if you do not sign up when you're first eligible, then they will go through underwriting, or which means they will look at your health history to determine if you can join the plan. With that being said, some states make that a little easier than others. And so it's just really important to know what your state rules are. Unlike with original Medicare, which is administered through the federal government, Medigap plans are kind of managed and regulated at the state level. So penalties. Part A penalty is up to a 10% increase for the monthly premium for twice the number of years you do not sign up. So if you do not sign up for Part A when you're first eligible, and you still don't have coverage through your employer, then you would have if you go 2 years without being covered, then you have to pay the Part A premium for 4 years. Part B is also a 10% increase for monthly premium for each 12-month period you do not sign up. And so if you do not sign up when you're first eligible, there is a time every single year, which is January through March, where you can sign up for Part A and Part B if you did not sign up when it was your turn to sign up. And if you do not go a full 12 months without the coverage, then you will not have a penalty for Part B and for Part A. Now, with that being said, Part D, that penalty is a thing that I forgot to mention, unlike with Part A, where that penalty will go away, Part B penalty will stick with you for as long as you have Part B coverage. Now, Part D penalty is a little different. Unlike Part A and Part B, which is it has to be a total of 12 months. For Part D, it's for every month you go uncovered without a prescription plan. And so what they will do, they will take 1% of the natural base beneficiary premium, which for this year is $36.78 for every month you go uncovered. When I was counseling a person one-on-one, I think it was probably back in 2018. She had never signed up for a Part D plan. Part D is fairly new to the Medicare world. It's only been around for about 20 years. The Medicare got signed into law in 65. And so for 2006 to 2018, she never signed up for a Part D plan. So that was 144% of the national base premium that she would have to pay on top of her monthly premium. And so you can see where not signing up for Medicare can be quite costly. So Medicare and your business. So if you are an employer and you have less than 20 employees, then they have to sign up for Medicare when they are first eligible, when they turn 65. And Medicare will then become their primary insurance. If you work, the one caveat to that, would be if you are enrolled in a group health plan, and if one of those other employers in that group health plan qualifies as a large employer, then your staff can fall underneath that as well and use the rules that I'm about to mention with the more than 20 employees. So these people can choose what they want to do. But if when they do enroll, Medicare will become their secondary insurance. So the common scenarios are with the small employers, they enroll in Part A and Part B during an initial enrollment period. And then if they fall in the group health plan category, then they would then move over to the large employer. So an employee may decide to go ahead and sign up for Part A and Part B during their initial enrollment. And we may remember Part A is free. So some people may elect to sign up for Part A and delay their Part B enrollment. Or you have scenario 3, where you delay Part A and Part B enrollments until the time you retire and you go through the special enrollment period. So for the initial enrollment education timeline, about 6 months out, you're going to receive an overview letter. And then 3 months, you're going to have a Medicare educational materials start coming through. Third-party resource list is going to be the birth month, and then you're going to get final communication around 2 months after your birth month. So engaging your employees on Medicare, make sure you have clear and consistent communication, refer employees to trusted, reputable sources, and educate employees about Medicare prior to eligibility. If you are an employer and you would like, you feel like this presentation would be valuable to your employee, we can always do that type of presentation as well. And we're about to go over a list of resources as well that you can use to give to your employees. So the first one is being Medicare.gov. This is where a person can go online, create an account, and they can see their Medicare summary notice. They can, if they need a new card, they can request a new card or download a card. They can see what their medications are going to cost. It's a really great resource, creating an account and doing that. Or you can call Medicare directly at 1-800, at their 1-800 number, and those numbers just equate to Medicare. So it's just 1-800 Medicare. The Medicare Rights Center is a great nonprofit organization that AARP partners with when doing some of our Medicare materials. And another one would be the SHIP, or the State Health Insurance Assistance Program. And this is also a free and unbiased resource that is through a federal grant that allows the aging networks in your state to have this program that provide free and unbiased Medicare counseling. They're not going to enroll you in specific plan. They're just going to show your options and let you take the leadership seat when making a choice. We also have AARP.org/Medicare, which is going through a revamp and will have a refreshed look to it. And on there, you will be able to go through, I'm going to tell you future state. You're going to be able to go through and kind of see where you're at in your Medicare journey, and to with different subject matters that pertain within the Medicare atmosphere. Next, we have AARP Medicare Enrollment Guide, which is eventually will be morphed into the AARP landing page. And so this is something that is available right now currently on AARP, and you can, if you just are in a quick and a hurry, you can just view your situation, answer a few questions, and then you can go along your get a quick answer within 5 minutes, or you can explore the guide, get more in-depth information about your initial enrollment period. Also, we have a new experience called AARP Navigator Medicare Initial Enrollment. So if you are a member of AARP, you can then kind of answer a few questions, and then you'll get a course that is designed to where you're at in your Medicare initial enrollment journey. And I'm so excited because we're about to launch our second course, Making the Most of Medicare, which will then take people on our journey who are already on the Medicare so they can maximize their coverage. And then we will also be releasing a course for those who are going through open enrollment as well. We have a few resources on our employer page that pertain to Medicare. Some downloads that you can get that will help people understand about the employer size and what are their options when they're deciding, do I need to take Medicare, if I need to take, or if they can stay on their employer-sponsored healthcare. So in conclusion, Medicare is quite complex, but it's also a great equalizer, something that we all need to know and at some point in our lives. Educating your employees on Medicare and what their options are is not only something that is beneficial for both the employer and the employee. You can also save the employees money if they do not enroll when they are first eligible. And remember, AARP, CMS, which is who administers Medicare, the SHIPs and the Medicare Rights Center, we all provide really great resources that are free and available to you. And do we have any questions? I know we went through a lot quickly. Someone in the chat put, will you be sharing the slides or resources? I had an employee issue, so sign in slightly late. Yes, we will be sharing, and it was recorded as well. So you can definitely go back and watch it as well.
Excellent. Thank you, Xavier. We are taking any questions you have for him. You can go ahead and place that in the Q&A or in the chat. And in the meantime, Xavier, want to give people an opportunity, you know, to hear some common FAQs that we get when we run these webinars. You know, as a small business owner, what are some of the biggest mistakes or misconceptions you see people make when it comes to Medicare?
Yeah, the most important thing is just knowing your enrollment periods, making sure you're signing up when you need to, or if you can delay, that you know the rules behind that. Because we just want to make sure that you do not have any penalties once it comes for the time for you to sign up. So remember, your initial enrollment period, when you first turn 65, is 3 months before your birth month, and 3 months after. And the same concept of that 7-month period is also for those who are on disability. So think of their 25th month as their birth month, and they have that same 7-month period as well.
Excellent. Super helpful, Xavier. Thank you so much. And if you could just repeat some of the resources you mentioned here, we'll also make sure for those who are tuning in that if you've registered, you'll receive the email. But Xavier, if you could just give a high-level overview of, again, of some of the key resources and where to go.
Yes. So the first one is just going to be the AARP.org/Medicare, which is going to be the Medicare landing page on AARP. And they're going to have a lot of different resources. You're going to see the latest and greatest in Medicare, so all the latest breaking news and how AARP is fighting for you to ensure that Medicare stays a program that people are happy with and they can get the most out of their benefits. So you're going to see that. And as I said, you're going to start seeing a transformation of that Medicare landing page as we combine multiple resources into one comprehensive resource to make it easier for you all to navigate. And you know, as most sites, we're also adding an AI chat box to that page as well. And so currently, before all that merging happens, you can go to the Medicare enrollment guide to go through. You can answer a couple of questions, get a little spitfire answer at the end, or you can kind of go through and kind of go through six different sections out there and just read more information. Also, we have our new tool, which is AARP Navigator. First one being AARP Navigator Medicare Initial Enrollment. And this is only available to members. But it is a great resource where a person will answer a few questions and they get a self-designed course that is tailored to them and where they're at in their Medicare initial enrollment journey. There's 3 different chapters you can download, and each chapter has a workbook that you can download, you can take notes as you're going through the course. It's a really great resource. And the really great thing is, I know we're talking about Medicare, but we're going to have topics in work and jobs, in caregiving and other areas within the AARP ecosystem that will be launched throughout the rest of the year. And also the CHIPS. If you need free unbiased Medicare counseling, especially as we're gearing up for open enrollment, you can contact them and they will set you up with a counseling session and get you help.
I think that one-on-one help is so critical. I want to pass it over to Thresette. I see her hand raised.
Yes, thank you so much, Xavier and Ashley. This was a lot of great information. And you might have answered it in your conclusion, Xavier, about where they can go and get additional resources. I was wondering if anyone that intended to make this and did not get to and something came up, would those places you just mentioned be the best place for them to go and get this information?
Yes. Yes. So
Okay.
all the resources that are listed at the end, really great. You can't go wrong with any of them. And the great thing about the SHIPs that they're going to be their local people in your community. For all you know, your neighbor could be a SHIP counselor. You just never even knew it.
Yes, yes. Appreciate that. Thank you so much.
You're welcome.
Thank you so much to Xavier. Thank you to Thresette. Again, thank you to all of our partners. Big shout out to NAWBO, AARP, and Public-Private Strategies. As I mentioned again, we're running these as a series throughout the summer and fall. Our next event will be July 31st at 2 p.m. Eastern. That is exactly 1 week from today. The recording will be distributed, and as I mentioned, you'll have access to the slides and the information shared. We really want to thank you again for taking the time out of your very busy day to get educated on Medicare for small businesses and for business leaders. So with that said, this now concludes our July 24th webinar, and we thank you so much for joining.